Hello everyone. I am your pharmacist in charge, and today I would like to talk about a type of medication, used often in the hospital to prevent blood clotting. This is an educational video on how to use subcutaneous injection Enoxaparin, or better known as Clexane. Before we dive into injection technique, let us learn about this medication. Basically, what is Enoxaparin or Clexane? Enoxaparin is indicated to prevent the formation of blood clots in the vein. Blood clots occur when blood thickens and clump together. Blood clots usually form in the deep vein in the body. For example, lower leg and thigh. This clot can break off to form emboli. For example, loose clots. Just like a car, this emboli will then travel through the bloodstream and subsequently may lead to the blockage of other vein in the body. This will eventually disrupt the blood flow to the blocked area, causing complications such as stroke or pulmonary embolism. Enoxaparin have multiple uses in medical world as treatment or prophylaxis option to prevent blood clotting. These are the strengths available in the hospital. Dose, frequency and duration is based on indication. Some patients will inject once daily while others might inject twice daily. Take as directed by your doctor. If missed dose more than 6 hours, skip the dose and take the next dose instead. Every medication has side effects. However, some patients can tolerate the medications and do not experience any side effects. Enoxaparin can cause bleeding. So, if you experienced any signs and symptoms of unusual bleeding, such as bruises from unknown sources, blood in urine, black stools, gum bleeding, or heavy menstrual bleeding, do not hesitate to seek your doctor immediately. As this medication increases your risk of getting bleeding, you must make sure to inform healthcare professionals that you are taking this medication when you want to do tooth extraction, consult for medications, herbal or supplements. So, now I will show you how to inject this medication, but before that, you must know where to inject. The injection area is either on the right or left side of the abdominal, at least 2 inches from the navel, and out toward the side. You also can inject it in the thigh area. The next time you inject, you must inject at different sites, approximately 2 fingers from the initial injection site. Next, I will show you how to open the medication. Firstly, tear off the protective covering. Then, remove the pre-filled syringe from the packaging. After that, pull off the needle cap carefully. If you see any bubble, no need to expel it out because this action may cause your medicine to be lost. Now, I will show you how to inject the medication. Sit comfortably before you inject and make sure you can see the site you want to inject clearly. Wash your hands, then dry them. Clean the injection area and allow it to dry. Squeeze the skin between thumb and forefinger. Introduce the total length of the needle vertically into the thick part of the skin fold. Hold the skin fold throughout the procedure, then, push the plunger until all contents of the syringe has finished. Hold for 10 seconds before pulling out the needle. After 10 seconds, remove the needle from the injection site. At the same time, release the skin fold. It is very important not to rub the injection site after administration. After you use the needle, don't throw it like you throw your rubbish. Make sure you drop the used syringe needle first into a thick plastic container, bottle such as an empty detergent bottle or something similar. When the container already full, cap tightly, wrap in black trash, and then only you throw with the other household waste. You can also send the bottle to the nearest health facilities for proper disposal. Thank you for listening.